It's my pleasure now to introduce Dr. Lisa Lim, who is a licensed psychologist at Cal State San Marcos. She got her BA and her MA from Cal State San Marcos and her PhD in counseling psychology from Southern Illinois University. She's practiced for 11 years at a variety of settings: community mental health, university counseling centers, wellness centers, career centers, and she's also in private practice. We feel so lucky to have her take time to address us, and it's a great pleasure to present Dr. Lisa Lim.
Thank you so much for my introduction. I'm going to pin my video real quick, which will make me the only video that will pop up. And I have a presentation to share with you, and it's an abridged version of a longer presentation that I often provide. The longer one includes some interactive opportunities and some opportunities for practicing some of the coping skills I'll be offering today. So in the future, if you'd like me to come back for the longer version, I'd be happy to do that. But today, I think it actually worked really well to go after Pamela, because some of the material that I had to skip over just for the interest of time had to do with health. And my recommendations are exactly what everything that Pamela said. Absolutely, the importance of nutrition, of connection, of exercise, of sleep. So I feel like it's a great compliment, which makes me feel a lot better that I had to skip over that, because I feel like you still got that really helpful material. And now, before I move over to my presentation, I want to let you know that I am having sound issues with my laptop. So I have this set of headphones that I'm using. I have a backup set of headphones. So please, if you can't hear me, unmute yourself and let me know. If you communicate via the chat, I might miss it, but if you unmute yourself and let me know that my sound is out, I can make some changes to address it. I also want to let you know that I'm fostering a cat. So if there's cat noises in the back, she likes to come over and ask for a cuddle when I sit in this chair. So I apologize if that becomes distracting. You might be, depending on what she does, you might see a tail, which actually I think I love when I see pets and children on Zoom. Okay, I'm going to begin my screen share and start my presentation. Okay. Thank you all for having me here for the AAUW IBC meeting. It's an honor because, like, at Cal State San Marcos, where I work currently, I was the advisor for the AAUW campus branch. And so I feel like there's a connection there already that I like. And I'm here today to talk to you about how to cope with COVID-19. To begin, I also wanted to take a moment to mention that my pronouns are she, her, hers, and ella. Ella is how you say she, her, hers in Espanol or in Spanish, which is my first language. I currently work as a psychologist at Student Health and Counseling Services at Cal State San Marcos, and I'm presenting to you today from my home in Vista. It's a very rainy day here. And I wanted to acknowledge that I, in Vista, am a guest on traditional unceded Luiseño Payamcowishem land. It's important to acknowledge whose land we reside on as a way of combating or countering the erasure of Native communities. This is important to me as someone who cares a lot about social and racial justice. I'm going to include in the chat, if I can pull it up here. It's hard to pull it up when you're presenting, so I'll see if I can do it. No, it's not coming up for me. In fact, if someone can type something in the chat, that'll pop it up for me. Can someone you can send anything in the chat real quick, and it'll populate it for me. It's not working. Well, that's okay. Later on, what I'll do is I'll include a link for you to check out whose land you reside on. It's native-land.ca, but it's not just for California. I know some of you are in Texas and I think Montana and Mexico, so you can all check out whose land you're currently on. Okay, so COVID-19, oh my goodness. It has been 10 months, and none of us have been prepared to live through a pandemic, and certainly not to live through a pandemic for as long as we have. And when this began in March 2020, in California at least, with a lot of the stay-at-home orders around mid-March is when Governor Newsom sent out the news of us all having to stay home. We did not anticipate that we would be here this long and that things would evolve in the way that they have. COVID-19 has been something that has been unprecedented, and it has impacted many areas of our life in profound and long-lasting ways that will be felt long after COVID-19 is over. Now, often what we were doing and what we were thinking and feeling back in March, or for those of us who were aware of COVID-19 back in December 2019, when it was beginning to emerge in the East, what we were thinking, doing, and feeling then is very different in some ways than how we are feeling, what we are doing, and what we're thinking now, 10 months later. What's different now is we have been doing this for a long time, nearly a year of on and off stay-at-home orders. We have learned to use, as Norland was saying, Zoom, video chats, FaceTime. We've had to go back to phone calls, text messaging, and using technology to connect in new ways. For some of us, we have learned to cope with the pandemic in ways we didn't expect. And for some of us, we are still figuring that out. And that's why I'm here today. And for those of us who aren't sure what we're feeling, I want to present to you a list of normal reactions. COVID-19 has brought not just a global health pandemic, but also significant multiple pandemics, as many have called it, because of the political division, because of the racial tensions and the racial injustice that have been in some ways highlighted by COVID-19 as well. So here are some of the most common reactions that many of us could be having 10 months into this double pandemic. Now, this is not an exhaustive list. This does not include all the emotions that you might be experiencing, but it is a list of the most common that I'm seeing clinically. And I'll highlight some of them here. Some of us are experiencing exhaustion. It has been 10 months, and we know now that it is likely to be at least 4 to 6 more months of living in this way. Maybe not exactly as we are today, but in this way, in some ways, living with COVID-19. Now, there's some hope because of the vaccine, but many of us are exhausted of having to be so watchful about what we're touching, who we're coming into contact with, are they standing 6 feet away, having to change a lot of the plans we had for our life, getting together, going on walks, getting together for meetings like this. And it has been exhausting to live in what I call a chronic state of stress. For some of us, we can't even tell that we're stressed anymore because we've been living with this sort of level of stress for so long. It's almost become a sense of normal. But what that is doing is it's impacting our health, mental and physical health. And a lot of us are feeling exhausted and overwhelmed by this. Some of us may be feeling quite anxious about how much longer this is going to be this way, and how the vaccine will impact us long term, how COVID will impact us, how the new presidency will impact us in maybe helpful or unhelpful ways. Some of us might feel quite frustrated that our country, who's supposed to be leading in many ways, is so far behind when it comes to the handling of COVID-19. There are some countries who had periods of time, months long, with no new cases, and that has not happened in this country. So some of us might feel quite frustrated, perhaps with the way that our own governor in California is handling things, or the way that our city is handling COVID-19. For others of us, we might feel quite lonely and sad about the level of disconnection we are experiencing. This is especially true for folks who are living alone. There's just less opportunity to connect with the closures of restaurants and gyms and at times parks, depending on how COVID is. And that's been especially challenging. Now, I also want to acknowledge that for some of us, COVID-19 and the stay-at-home order has provided a sense of calm, maybe not initially, perhaps 10 months in. For folks who tend to be more introverted and who now have less things going on in their life and get to focus on the people they live with and the things that are most important to them, this has provided a sense of calm. I know for me, I identify as an extrovert. I love being with people. I like talking with people. I'm very much a people person. I draw my energy from connection with people in person. This was a challenge for me at first, but now I've found a sense of calm. Now I do a daily gratitude practice with some friends via text. I have downloaded the application Marco Polo, which is a way to leave video messages. Like a text message, but it's a video, and it's been a nice way to connect with my parents. And even though I'm wearing a nice top at the top, rest assured I'm definitely wearing pajama bottoms and slippers and fluffy stuffed socks. And that has provided a sense of calm, that there's a part of me that feels greater physical comfort at home than I would driving to work and worrying about parking on campus and being in my office, which is often way too cold for my liking. So for some of us, there's a sense of calm in this as well. For others, you might feel gratitude, just grateful that we have distilled our life to the essentials. And many of us have the privilege of having internet connection that allows us to connect. Some of us have been able to retain our jobs. Some of us have retained our health. Some of us have had people who've experienced COVID-19 and survived. And so in the midst of all of this, we've also found a greater sense of gratitude for what we do have. And that is really healthy as well. For some, we've experienced hope. Maybe there's some hope with the vaccine. I know because I work in a health center. I have already received my first dose because I work in person sometimes. And so as a healthcare provider who works in person with people, I was eligible in the 1A tier. I'm very grateful for that and hopeful that that means some positive changes for our ability to connect with one another. Now, for others, we have experienced many of the things on this list, sometimes within the same day. And when our mind is experiencing a lot, it can become overwhelmed and it can numb out, meaning that we almost feel nothing. We feel like we are not feeling any emotion. And that's an indication that we are overwhelmed emotionally and our mind is choosing to take a break. That's okay. It doesn't last forever. You will reconnect with your emotions. But what that means is likely that you need to take some time to recharge and focus on yourself. Now, if you're looking at this list and thinking, I don't even know how I feel, I have no idea. One of them, maybe all of them, none of them, I'm not sure. That's okay. Here is a helpful guide to learn how to reconnect with yourself and learn to check in with how you're doing. And these are just some prompts that I encourage you to either write about if you are someone who likes to write, talk it through with someone who you care about, who's willing to talk back with you about how they're doing, or just thinking about these in your own mind daily. To check in with how you're doing cognitively, I encourage you to take a moment to ask yourself, what thoughts keep coming up for me today? And where do my thoughts wander? By asking yourself and checking in, this is a good one at the end of the day to sort of take inventory about what kinds of thoughts keep coming up for you, because that's going to tell you what's drawing most of your cognitive and mental energy. That's going to tell you what things really require your attention. It's going to communicate to you what it is that you need to be well. For me, at the beginning of the pandemic, where my thoughts kept going every day was about the risk of exposure. My partner